All right, welcome. Today, we're going to decode the body's vital signals, and we're going to go way beyond just memorizing numbers. We're diving deep into the why behind the changes so you can build that solid clinical judgment you need, not just for your exams, but for your entire practice. So here's our game plan. We'll break down each vital sign one by one, hitting all the must-knows for your exams. And this is the best part, we're going to connect all the dots and see how these signals come together to tell a complete patient story. So what are vital signs really? Think of them like the body's headlines. They give us a quick, absolutely essential peek inside a patient's condition and create that all-important baseline for everything else we do. Our toolkit is made up of these 6 key measurements: temperature, pulse, respirations, blood pressure, O2 saturation, and pain. Together, they give us a snapshot of a patient's health. But the real magic happens when we start tracking their trends over time. Okay, first up, temperature. This is so much more than just checking for a fever. It's really a window into the body's metabolic state. And it's one of our first clues that the body might be fighting off an infection or inflammation. This right here is our target range, kind of the sweet spot. We generally consider a fever to be 100.4 degrees Fahrenheit or higher, but this is the normal baseline we're always comparing against. Any little deviation, whether it's high or low, is a signal for us to start investigating. And now we get to the why. A temperature change doesn't always mean there's a nasty bug. A patient's temperature is actually influenced by a ton of different factors, and knowing what they are is absolutely key to interpreting it correctly. Our body temperature is constantly in flux. It naturally dips in the morning and hits its peak in the afternoon. Things like exercise, stress, even hormones, they all cause shifts. Recognizing these normal, everyday variations is what helps us spot the changes that are actually significant. Okay, listen up, because this is a huge exam must-know. Knowing when not to use a certain method is just as important as knowing how to do it. For a cardiac client, taking a rectal temp can actually stimulate something called the vagus nerve, which can cause their heart rate to drop dangerously. This is a classic patient safety point you absolutely have to know. Next up, let's talk about the dynamic duo, pulse and blood pressure. You look at these two together and you get a really clear picture of the cardiovascular system. Basically, how well the heart is doing its job of pumping blood around the body. So the pulse, it's just the heart rate that you can actually feel at an artery. It's a direct count of how many times the heart is contracting every minute. And for a resting adult, we're shooting for that 60 to 100 beats per minute range. And this slide perfectly illustrates the why behind what we see. So imagine a patient is bleeding. Step 1, they're losing blood volume. Step 2, with less volume in the pipes, the pressure in the arteries naturally drops. So what does the body do? Step 3, its brilliant response is to tell the heart, hey, beat faster, to try and compensate and keep that oxygen moving. This is the body trying to prevent shock. A rising pulse and a falling BP is a classic urgent warning sign that this exact process is happening. Now, blood pressure tells an even more detailed story. The systolic, that's the top number, is the force during the heart's big push, its contraction. The diastolic, the bottom number, is the pressure when the heart is relaxing between beats. You need to look at both numbers to really understand the stress on the vascular system. Okay, this table, you absolutely have to know these hypertension categories. They're the standard for diagnosing and treating high blood pressure. Seriously, take a second and just look at this chart. Being able to quickly classify a reading from just elevated all the way to a hypertensive crisis is what lets you understand the patient's risk and the urgency of the situation. And here is another exam must-know, a classic trap. Cuff size is everything. If you use a cuff that's too small, it's going to squeeze the arm too tightly and give you a falsely high reading. If it's too big, it won't get enough pressure and you'll get a falsely low reading. Remember, garbage in, garbage out. Getting the technique right is essential for getting accurate data. All right, let's switch gears and talk about the lungs. The big questions here are, is the patient breathing effectively? And is that breathing actually getting oxygen into the blood where it needs to go? That's where respirations and O2 saturation come into play. This slide contrasts the two measurements perfectly. On the left, you have respirations. That's the mechanical act of breathing, right? One breath in, one out. But on the right, you have O2 saturation, which is the result of that breathing. It tells us how much of the hemoglobin is actually carrying oxygen. It's so important because you can have a normal respiratory rate, but still have terrible saturation if that gas exchange isn't happening properly. Here is a critical threshold you just have to burn into your memory. An O2 sat below 90% is a major, major red flag. It means the oxygen supply to the body's tissues is dangerously low, and it requires you to take immediate action and notify the provider, stat. And now for our final and definitely most unique vital sign, pain. Think about it. All the others are objective numbers we can measure with a device. But pain is a completely subjective, internal experience. So our role has to shift. We're not just measuring, we're partnering with the patient to help them describe and quantify what they're feeling. The number one golden rule of pain assessment is this: believe your patient. If they say they're in pain, they are, period. Our job is to give them the right tools to translate that personal feeling into a data point we can actually track. For most adults, a simple 0 to 10 scale works great. For kids, or for adults who have trouble communicating, a visual tool like the Wong-Baker Faces Scale is an absolute lifesaver. So what if your patient can't tell you they're in pain? Well, that's when you put on your detective hat. You have to look for these nonverbal clues. And notice something really interesting here. Some of these are changes in our other vital signs. An increased heart rate or a spike in blood pressure can literally be the body's way of screaming that it's in pain. Okay, this is the most important part of the whole thing. We've looked at each signal on its own. Now, let's put them all together in a real-world scenario and see how they combine to paint a crystal clear clinical picture. This is where simple assessment turns into true clinical judgment. So here's our patient. They got to the floor from the recovery room at 1 o'clock. It's now 2 o'clock, just 1 hour later. We have 2 sets of vitals. Let's look really closely at how they've changed in that 1 hour. Okay, the trend. The trend is everything here. Don't just look at those 2 o'clock numbers in a vacuum. Compare them to the baseline from an hour ago. The heart rate is way up, the blood pressure has absolutely plummeted, and the O2 saturation is starting to drop. Each number is a piece of the puzzle, but the trend tells the story. So what is the body screaming at us right now? Do you see it? Remember that compensation mechanism we talked about? A rising heart rate with a falling blood pressure? This is the body's classic textbook response to losing volume. And in a patient who just came from surgery, this is the classic presentation of a hemorrhage. See? This isn't just a random collection of numbers. It is a clear, urgent narrative that is demanding action. And that, right there, is the incredible power of knowing how to decode the body's signal.